My name is Maya Ragavan, and I was a psychology major and a global health minor at Northwestern. So after I graduated, I took a year off and I worked as a case manager, and then I started medical school at Northwestern at the Feinberg School of Medicine. I'm a fourth-year student right now. I also took a year off between third and fourth year to do research abroad in India. When I was at Northwestern, I studied abroad in India as well through this. It was before a lot of the the programs were there. So my program was actually an unaffiliated one through the Minnesota School of International Development. And so it influenced me quite significantly because I actually found the place where I did my Fulbright when I was studying abroad. And it was the first time, so when I studied abroad, and part of our experience was an internship. And the internship was at a nonprofit organization that had health centers, but also had a population-based approach of looking at healthcare disparities. They were trying to reduce maternal mortality through both like clinical work as well as public health work. And it was the first time I saw the combination of those two disciplines, clinical medicine and public health, working so well together, so that I decided I would pursue an MD and PH, and then I went back there for my Fulbright. So it was a pretty significant experience for me. So the mentorship program, so I was a mentor for two students. One was a sophomore and one was a senior. We spent a lot of time going over research abroad. Both of them were interested in doing research abroad. So both kind of broader ideas, like how do you come up with a good idea, as well as some of the more specifics, like how do you get IRB approval, how do you find a good site abroad to do your research, how do you find a good mentor, things like that. A couple of things. I mean, I hope that they learned a little bit about how to do research. I tried to emphasize the idea of sustainability and the importance of sustainability when you're doing global health work. For example, one of them is part of a student group that they're trying to do some work in India, and I had a lot of conversations with her about making sure that their work was sustainable, and that's something that I believe very strongly in, so hopefully that was something that came across. That's a good question. I think it's really hard. I think there's a lot of emphasis on going to medical school as the only way to do global health, and I think that that's wrong. There are a lot of different ways to do global health. I think that you should make sure that you know what your primary interest in, what your primary discipline is in, and then whatever that is, you can find a way to do global health. I think it's also really important to know that global health doesn't mean you have to go abroad. Sometimes for some people it's easier and better for them to stay domestic and work on global health issues, whether it's like working with immigration issues or anything like that. So I think that those are the two pieces of advice I have. I think the biggest life lesson I've learned is to not see things in black and white. I think it's very easy to see things in extremes, and with public health you really need to see the shades of gray. Most ideas, most solutions have positives and negatives to them. There's no one right answer to a particular public health solution, and I think that was a very important lesson for me to have learned. And I like Gandhiji's quote about being the change you wish to see in the world. I think that that's a nice quote. He also has like a quote about how charity begins at home. So I think through all of this work, like helping people abroad and like wanting to do good for people and wanting to do global health work, I think it's important to also remember your own family and your friends, and make sure that you're taking care of them as well.